Hello, everyone. Welcome back. Today, we'll talk about screening guidelines in Canada. A lot of times, you might have seen questions in QBanks or MCC practice test asking you about, for example, a woman presenting at the age of 40, having a breast lump. What is your next step? So, are you going to follow up or are you going to do screening for breast cancer? A 75-year-old woman coming for cervical screening. Are you going to do it or not? A 65-year-old person coming for prostate cancer screening because he's concerned for prostate cancer. So, are you going to screen him or not? All these questions can be answered only if you know the exact year when the screening begins and when the screening ends in Canada. Each country has different guidelines, and the guidelines in Canada, we'll talk about them today. And all of these guidelines come directly from one resource, which is called Canadian Task Force. This is a website which has all the guidelines in detail. I compiled those guidelines and made it easy for you and put them in one portal so you can access them. Also, try to read them just one day before you go for exam so they are kind of fresh in your mind because the age and years kind of tend to mix up. Okay, so let's talk about it. The first one that we have is abdominal aortic aneurysm, AAA. How often do you screen? It's just one time screening. You don't have to screen it every year. No, 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 no. It's just one time screening for men who are 65 to 80 years. I repeat, just one time screening only for men who are 65 to 80 years. Do you need to screen men who are over 80? No. Do you have to screen women? No. Okay? So it's just one-time screening only for men 65 to 80 years. Breast cancer, as I just mentioned, a woman presenting at 40 and she's concerned about breast cancer. Would you screen her? No. You would screen her at 50. The screening for breast cancer starts at 50 and ends at 74. And what do you do for screening? Do you do ultrasound or mammography? You do mammography. How often? Every 2 years. Okay? Cervical cancer. This is very common. All of us go for PEP test. We start having our PEP smears at the age of 25 and we finish them at 69. How often do we do that? Every 3 years. Every 3 years, women have to go for cervical screening test for cervical cancer through PEP smear, and it starts at 25 and ends at 69. Women who have turned 70, should they stop screening? They should stop screening only when they had 3 successive negative PEP tests. They had 3 successive negative PEP tests in the last 10 years. Only then you can stop their screening at 70. But if they had inadequate screening or they were not regular with their screening or one of their tests was not normal, can you cease screening at 70? No. Then you can go beyond 70. Unless you have 3 negative tests after 70, you continue testing. Even if she's 83 and she has like on and off one screening positive at the age of 69, you don't cease it at 70. You continue until you have 3 negative tests. Okay? Remember this age group, 25 to 69. Okay? Colorectal cancer, what's the age? 50. The screening for colorectal cancer starts at the age of 50, and when does it end? It ends at age 74. How do you screen it? There are 2 methods. The first one is fecal occult blood testing, FOBT. If somebody chooses to go for fecal occult blood testing, they can get their screening done every 2 years. The other method to do colorectal screening is flexible sigmoidoscopy. If somebody chooses to go for flexible sigmoidoscopy, it's done every 10 years. Is colonoscopy used for colorectal cancer screening? No. Okay? If you read the latest guidelines, colonoscopy is not recommended for screening purposes. It's either FOBT or flexible sigmoidoscopy. When does it start? 50. When does it end? 74. Okay? Esophageal carcinoma screening, is it recommended? No, not at all. What if somebody has Barrett's esophagus? Even no. What if somebody has dysplasia? Even no. So esophageal carcinoma is not recommended in normal population. We're talking about screening. Remember that. If somebody has Barrett's esophagus, they have symptoms and you want to diagnose them for esophageal cancer, yes, you can go for it. But we're talking about screening. You don't screen people. Screening means you are doing the test even before you know there's something wrong. It's primary prevention, right? So esophageal carcinoma screening is not recommended. What about lung cancer? Do you screen everybody for lung cancer? 55 to 74 years of adults who have 30 pack year smoking history. 55 to 74-year age group who smoked for 30 years, 30 pack year smoking history, or who quit less than 15 years ago. You screen them with low dose CT for 3 consecutive times. You screen them 3 consecutive times. What if somebody is not a smoker? Do you screen them? No. What if somebody quit smoking 20 years ago? Do you screen them? No. So smoking alone is not a prerequisite for screening. Smoking for 30 years or quitting less than 15 years is a prerequisite for cancer screening. Okay? And how do you screen? You use low dose CT. Do you use X-ray? No. What about this thing? For all other adults, regardless of age, regardless of smoking history, regardless of risk factors, the Canadian Task Force recommends not screening them. Okay, so we only screen people after 55 years who have 30 pack year smoke history or who have quit less than 15 years ago. And how often do you screen? Every year. For how many years? 3 years. That's it. Okay, you don't continue it until 74, you just cease it after 3 consecutive normal screening results. Okay, prostate cancer. Prostate cancer, do we recommend testing people for prostate cancer through PSA antigen? No. Why? Because PSA is not a reliable indicator of cancer. It's increased in prostatitis. It's increased in benign prostatic hyperplasia. So it's not a very reliable indicator. If somebody gets it positive, they get a false impression that they have cancer. Then they go through extensive testing, and it gives more harm to the patient than any good. So it's recommended that you don't do any screening for prostate cancer. 55 to 70 or above or below, no screening recommended. Okay? All right, that was it for screening. And next time when we meet, we'll talk about ethics, and I'll try to upload a video within a week. Thank you so much. Have a great day.